Very early ART may be one key to remission. By IDSE News staff, starting HIV antiretroviral therapy, ART, shortly after diagnosis could promote long-term control if a person discontinues treatment, according to a recent study. Scientists from several institutions used an animal model to identify a window of opportunity for the introduction of treatment that promotes remission of HIV infection. It appears that starting treatment 4 weeks after infection promotes long-term control of the virus following the interruption of treatment after 2 years of ART. These results highlight how important it is for people with HIV to be diagnosed and begin treatment as early as possible, they said. Research on the VISCONTI cohort of 30 post-treatment controllers provided proof of concept of possible long-term remission for people living with HIV. This group received early treatment that was maintained for several years. When they subsequently interrupted their ART, they were capable of controlling viremia for a period lasting more than 20 years in some cases. At the time, in 2013, the team leading the VISCONTI study suggested that starting treatment early could promote control of the virus, but this remained to be proven. In this new study, VISCONTI, started in 2015, the French scientists used a primate model of SIV2 infection that allowed them to control all the parameters, sex, age, genetics, viral strain, etc., that may affect the development of immune responses and progression to disease. They compared groups that had received 2 years of ART, starting either shortly after infection, in the acute phase, or several months after infection, in the chronic phase, or no treatment. The reproducible results showed that starting treatment within 4 weeks of infection, as was the case for most of the participants in the VISCONTI study, strongly promotes viral control after discontinuation of treatment. This protective effect is lost if treatment is started just 5 months later. Starting treatment 6 months after infection, a delay that our study shows results in a loss of effectiveness, is already considered as a very short time frame compared with current clinical practice, with many people with HIV starting treatment years after infection because they are diagnosed too late, noted Roger Legrand, Ph.D., the director of IDMIT, Infectious Disease Models for Innovative Therapies. We show the link between early treatment and control of infection after treatment interruption, and our study indicates that there is a window of opportunity to promote remission of HIV infection, said Ashier Syrian, Ph.D., the head of the Institut Pasteur's Viral Reservoirs and Immune Control Unit. The scientists also demonstrated that early ART promotes the development of an effective immune response against the virus. Although the antiviral CD8 immune cells developed in the first weeks after infection have very limited antiviral potential, the early introduction of long-term treatment promotes the development of memory CD8 T cells, which have a stronger antiviral potential and are therefore capable of effectively controlling the viral rebound that occurs after treatment interruption. They explained, "We observed that early treatment maintained for 2 years optimizes the development of immune cells. They acquire an effective memory against the virus and can eliminate it naturally when viral rebound occurs after discontinuation of treatment," Dr. Ashier Syrian explained. These results confirm how important it is for people with HIV to be diagnosed and begin treatment as early as possible. Early treatment has a twofold effect. Individually, as early treatment prevents diversification of the virus in the body and preserves and optimizes immune responses against the virus, and collectively, as it prevents the possibility of the virus spreading to other people, Dr. Ashier Syrian added. The study was carried out by researchers at the Institut Pasteur, the Commissariat à l'Énergie Atomique et aux Energies Alternatives, INSERM, Université Paris-Site, Université Paris-Saclay, and Institut Cochin, as well as with the support of ANRS Emerging Infectious Diseases and MSD Avenir.